Hey everyone, just wanted to give you a update now that I went and saw the doctor. Again, I had the unilateral gynecomastia surgery on my left side, and yesterday I went to go see the doctor for a follow-up visit, and he removed the stitches next to the nipple on the left side and next to the nipple on the right side, but he left the stitches on the top of the nipple. So just again, I want to give you a quick little update on how that went and the projections for the future. Right now I'm about 10 days in, or yesterday when I went to see him I think it was 9 days, so today's day 10, and give you an update on what I'm going through, how I feel, and actually what it looks like for those of you who have those questions. I saw him yesterday, everything went pretty good, and he had a lot of positive things to say. I was a little concerned because when he did it, he removed quite a bit of my areola on the top of the nipple, and he left quite a bit on the bottom. So my nipple seems to look a little puffy and larger than I had expected. So I brought that up to him, and he let me know that when he was doing the surgery, and I'll show you in a second, I'll take my shirt off. When he was doing the surgery, he removed as much of the areola on the top as he could, but he can only cut so much of the nipple without damaging the tissue to the point where the nipple actually dies. So he reassured me that when I come in a couple of months, after all my checkups and my follow-ups, if I'm still not happy with it, included in the cost that I already paid, it cost me about $3,000. Included in that cost, he's going to, under local anesthesia, so just take a needle and numb me like you would at the dentist, he's going to numb me up, and then he's going to trim the bottom of my areola and possibly a little bit on the sides to reshape it and get it to where I'm satisfied. So that really made me feel comfortable. I was glad he said that, because I was a little nervous about that. Going through this entire ordeal, the pain, the cost, and just the fact of the time off of work and all these different issues, I was concerned that I wouldn't be completely happy with the results. As for scarring, I was a little concerned about the scarring, but it's not a major issue with me because I do have a hairy chest, so it's going to cover up most of the scarring, and I kind of look at it as a battle wound. So I'm not worried about the scarring so much, but he did cut extensively, and he explained to me why he had to do that. When I was younger, when I had this gynecomastia, if I would have taken care of it sooner, he wouldn't have had to be so extensive on what he had to cut. Because my nipple was deformed, if you will, it was too large. The areola was really, really big, and it was not in the right place. So he had to trim and fix that like he would a normal breast augmentation for like a woman. So he had to shape that and put it back to where it was supposed to be. So I understood when he explained that to me, because I've seen a lot of gynecomastia videos where they didn't have to do that. They just cut around the nipple, they took it out. But if he did that and he removed as much areola as we wanted, he would have to, in essence, cinch it up and make it tighter, which would give me like a rippling effect around my entire nipple, and it probably still wouldn't look that good. So he explained to me how that would happen. So I understand where he was coming from. So when you see it, understand why it is he had to cut as much as he did. Plus the size of my gynecomastia, I forgot to see how big it was, but I have that on a piece of paper. But it was pretty extensive. It was actually larger than a golf ball, the entire thing. So it was pretty big. So that's why he had to cut as much as he did. So I feel really comfortable and glad that in a couple of months he's going to put me under local, and he's going to trim the bottom of the areola, and I'll show you why. He's going to trim the bottom of it and shape it, make it look a lot better, make it look a little bit flatter. I look a heck of a lot better in all my clothes. I feel a lot better. So I'm really happy about that. Pain. Let me talk a little bit about pain. Right after the procedure, I took a prescription pill for the pain, to manage the pain. It really wasn't that bad, but I didn't know how bad it was going to get, so I took a pill. After that, after the first day, day 2, 3, 4, 5, even 6, I really didn't have any pain. Like hardly any at all. Very, very minimal. Now, day 7, 8, 9, and now we're in 10, he's saying that my nerves are starting to, I think he said my nerves are starting to come alive again. I don't know what that means, but I guess because he cut all the tissue, the nerves are starting to heal, and they're starting to feel a little bit of pain. So real tender on the incisions and around the nipple a little bit. But another thing is where they shaved my hair. My shirt keeps snagging on where they shaved my hair. You know, you get the little pricklies, like the 5 o'clock shadow. That's real tender. This whole breast area is extremely tender. I don't like that. That hurts. So the pain has kicked in, and I've been taking my prescription off and on when I can when I'm not driving. I've been taking some prescription to help manage that and Tylenol. So the pain does kick in a little bit later, though. I was surprised. About day 6, 7, and 8, somewhere around there, day 9 and 10. You know, I'm on 10 now, so the pain's really kicking in a little bit, and I think it's going to subside here in the next couple days. So a little bit of tenderness, a little bit of swelling, but really not too bad. So just wanted to give you a quick update on where I'm at. I'll continue to update you. Here now I'm going to show you what it looks like. Okay, as you can see, this is what he's done. I'm trying to get the best light that I can, but you can see he cut near my armpit over here. He cut about 2.5 inches on this side, and then over to here he cut about 2 inches on this side. So this is the entire nipple. He took the stitches out here, he took the stitches out over on this side, and he left the stitches up in the top. I think some of them are they dissolve, they're dissolving stitches, but he's going to have to take out a couple more. So, and then you can see on the bottom, I mean, you can see how big this thing is. It's still pretty big. So when he puts me under local, he's going to trim the edges here, and then he's going to actually trim the bottom out because there's still quite a bit of areola down there, and he's going to make it flatter. So he's going to cinch it down and pull it down, so it's going to be nice and flat, just like my other side. The other side's almost perfect. So he's going to cinch this down, bring it down a little bit. Plus I've got some swelling, so it's a little bit larger right now. You can feel it in there. It's pretty swollen. But I don't have any infection or anything like that. So he's going to fix that up. He's going to trim it down, make it real nice and tight, and that's going to make me a lot happier. So just to give you a quick little look at it, I'll try and get in as close as I can so you can kind of see what it looks like. If you guys have any questions, please leave them in the comment section. Please like and subscribe, and I will continue for the next few weeks to keep you updated on how this is healing. And then I'll have to post some more updates about when he's going to trim it out and then tighten up my nipple a little bit and make that a little bit more presentable, because I'm not entirely thrilled with the results right now, but I am happy with what he told me he was going to do for the future. Again, it being included in the price that I already paid, I can appreciate that. So I thought I was going to have to go in there and he was going to want another $1,000 or $1,500 to do that. So I was really happy with what he said on that. So I'll keep you guys updated and look forward to the next videos to come. See you.